What is going on, gangers? Brother Namdi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 28 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Caillou from the show Caillou. I decided to use alopecia to describe Caillou's condition. Let's first dive into what alopecia actually is. So alopecia is actually a medical term for the condition of hair loss. It can mean hair loss of anywhere in the body, but most are referring to hair on the head for the loss. For causes/risk factors, we are going to name the following: genetics, which can play a very big part. Autoimmune disorder can be a factor, which will be alopecia areata, which we will talk about later on. Tight hairstyles such as ponytails, braids, because these pull on the hair roots. Poor nutrition, low iron, low vitamin D, and low protein. Hormonal changes, and just advanced age, and even stress, to be honest with you. Now on to signs and symptoms. These will be very bland, but all I can say is sudden or gradual hair loss, bald spots, and or thinning of the hair. How can we correlate this to my boy Caillou? Guys, Caillou is 4 years old, and most children that age have a full set of hair. That brother don't even have one string of hair on his scalp. Caillou's scalp is smooth, clean, and evenly toned with no redness, scarring, or irritation. This really makes me think Caillou has a specific type of alopecia called alopecia areata, which we mentioned earlier. And that is an autoimmune disorder that causes sudden hair loss on the scalp or other parts of the body. It happens when the body's immune system mistakenly attacks the hair follicles, thinking it's a threat to the body. And this will correlate with the sudden hair loss, which Caillou may have had. Now, how would we diagnose this? Obviously, a provider is going to do their physical examination. We would review medical history, and we would probably do potential labs to rule out any autoimmune disorder. And then obviously, last step, potential scalp biopsy for more serious cases. Now, this is the interesting part. How do we treat alopecia? If you're not looking for a cure and just for supportive methods, you can wear a hat. You can wear wigs. Other methods can include reducing stress and improving diet. This may change the hair loss. For alopecia areata, steroids are used to suppress the immune system. It's very key now. And for other cases, you can use Rogaine. But there's a big note on this. Rogaine will only prevent future hair loss. But the minute you stop using it, hair loss will likely progress. And last but not least, guys, just go to Turkey if you know for potential hair transplant. As always, if you have any of these conditions, please seek help, because at the end of the day, you matter. Fictional characters were used to give a different perspective in a situation. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 27 parts to this series. If you have a suggestion for part 29, drop it in the comments. If nothing else, y'all take it easy.